Okay, now you should see the first slide.
Fine, great.
Great. So it should work, hopefully. So, okay, good morning once again, good afternoon to China. Thank you for your nice introduction. So today I will speak about some elemental imaging, as you've been told, and it's really great pleasure for me to be at least part of this conference in this at least via online platform. So if you have some issues with some reception of my talk, if you can just feel free to jump and just stop me, and I will just maybe repeat. So as you wish. So the outline for me, I will just briefly start with some introduction to LIBS in biology. We have already seen a really nice talk by Vincent Motoros and also other colleagues. So I'm not going to speak too much about the basics and about the imaging as such. I will just mention some issues that need to be tackled when just speaking about elemental imaging in biology. So just some limitations and some challenges that we need to tackle. I will also show some. Sorry about that. I will also show some optimization of a LIBS system, and then I will just mention some case studies on soft and hard tissues and some future work that we are just working on. So for LIBS bioimaging, there are so many publications, so many papers, also from other groups, not just ours. I'm just mentioning two of our recent papers, the elemental imaging in soft in plant tissues. Oh, I don't know what happened. In plant tissues, and also some about some elemental imaging and elemental mapping of different samples from biology to geology to other applications. So this is quite broad review that covers a lot of information. So what I'm just would like to just mention some analytical and instrumental challenges, because we are speaking about really challenging application. Just the ablation of soft and hard tissues is really quite a challenge. From analytical point of view, the interpretation of data, what you just get from your analysis is really hard to interpret and just to put together with results from biology. So to just find some causalities between chemical images and biological processes, what's happening inside. So you need to have a lot of samples, a lot of replicates. This takes a lot of time in measurement and also in processing and preparation of those samples as such. And just doing some simple correlation with histological images. This is the least requirement that we should provide, and that's what we are also going to what I'm going to show. Also, instrumental challenges. LIBS is really nice and complementary to laser ablation in inductively coupled plasma mass spectrometry, which provides nice jobs in sensitivity and detection of those elements. And just providing this in LIBS is some challenge that we need to tackle, just increasing the sensitivity as such. Also, LIBS, that's something that we can really provide, is high repetition rate, just really reaching above 100 hertz repetition rate. Then, when we are speaking about biology and biological samples, so biologists are really interested in high lateral resolution, so just on micro level, and this is something where just getting to the trade-off between the sensitivity and the lateral resolution. So just decreasing your spot size, it also decreases your sensitivity, decreases the ablated mass. So this is quite some issue that needs to be solved. And also, LIBS usually is said to be a technique that doesn't need any preparation of the sample, but this is not true in the case of biological images, because in here, we really need to be careful in the preparation process. What you have already seen, just for soft tissues, you just do some formaldehyde fixing and then some paraffin embedding, just then some cutting with microtome. For the case of hard tissues, we are doing the epoxy embedding and cutting. I'm just going to talk and then switch and alter between soft and hard tissues. I just tried to divide it in my talk, but hopefully you can just follow my presentation without any problem. So what for murine kidneys, we just did this formaldehyde fixing and paraffin embedding, and we did some optimization. So we just decided to do two different optimization processes: the thin section and also paraffin block, directly analyzing the elements in paraffin block. So this thin section analysis we decided to do for this for this histological analysis, because in histology you have also always thin sections on this glass slide. So we try to do that. This is quite an issue for LIBS, because LIBS still is really destructive method in the from the point of view of biology and soft tissues. So the amount of ablated mass is really large, and those thin sections are not sufficient. So then we also moved to paraffin block analysis for potassium and magnesium. And I will show you some case study of polycystic kidney disease. That's quite a severe disease, that just there are some bubbles in the kidney, just putting this simple, and this is some way that we are trying to contribute to with LIBS to this research. And also what we did is also we did some bed chemistry, ICP OES, and for that you can see that for some repetitive analysis, you can see that there is some nice amount of potassium, sodium, magnesium, calcium, and so on in quite large amounts. And this is what we are just aiming at, basically with LIBS, just to just provide the elemental images of those elements. In the second case study that I'm going to talk about, this is just the analysis and elemental imaging of murine incisors and jaws, some teeth and bone, basically, from some mouse, this laboratory mouse that you can see here. And with that, we just do when we just harvest the organs or bones, we just do epoxy embedding, some cutting and polishing. And for this case, we also do some detection of lead in those hard tissues, because those mice were just exposed to toxic atmosphere for 6 to 9 weeks. And all those samples were obtained from our cooperation from the Czech Academy of Sciences, that just the cooperation between our group and just biologists is really necessary, and it takes quite some time before one gets really nice results because of the optimization. What we are using is just this LITIGO Firefly LIBS system that basically enables minimum requirements for some analysis, 100 microns, 20 hertz repetition rate, but we can just reach 15 micron and 100 hertz. Those are just the ranges in terms of what we can just use, and for the laser ablation of soft and hard tissues. I'm sorry, I'm just for this switching of slides. But what we are using for laser ablation, we are using two different wavelengths, 532 and 266 wavelength. This is really important in terms of ablation. 532, the second harmonic of Nd:YAG laser, is just better for the hard tissue ablation. 266, the fourth harmonic, is more appropriate for the analysis of soft tissues. We are using 20 or 10 millijoule respectively for individual wavelengths, and I will also just alter this repetition rate depending on the samples. So everything will be shown when we are just getting to it. We just follow those steps, the image of the footprints. They will just indicate what is the step size, what is the repetition, and so on. We are also doing the argon purge this increases the sensitivity, and then the detection unit, we are using two different spectrometers, tunable Czerny-Tarner spectrometer and broad range Czerny-Tarner spectrometer. And we are also just playing and optimizing the gate delay and so on. This is quite standard in LIBS, I would say. So the first case study, let me also mention the analysis of soft tissues of mouse kidneys. What we did in the first place. So in the beginning, as I said, we just did this two different optimization thin sections and paraffin blocks. So in this case, we just put some drops of zinc because we intended to just really go for zinc detection in soft tissues. Zinc analysis is quite important. Also, other elements for some cancer research. So we were just aiming for this. So far, the sensitivity is not so satisfactory. So we are just still improving the detection limits to be able to just provide some zinc analysis. Those results are already published in this publication by Anna Šindelářová. But what we then decided to do next, we analyzed those paraffin blocks and just did this calcium, sodium, potassium, and other elements. And here you can see the case of calcium, how how it's increasing with increasing energy, how we are just changing the signal to noise ratio, the indicator of sensitivity. You can see there is some plateau for 15 to 20 millijoule. And also the crater diameter also then just plateaus and just levels off, and you can see that for 15 to 20 millijoule we have really comparable results. So we just also did some optimization of other parameters, but in this case you just at least can see so what we are just how we are just developing this in this for this optimization. We always did the scan of the whole kidney, and this one scan, one map of the kidney was served as one measurement. Everything is explained very in very detail in this publication, or we can just then speak about it. So just we are doing optimization always in any kind of application when we are just changing those different matrices and so on. So what you can see here, just we did some polycystic kidney imaging, elemental imaging. We just you can here see some simple optical image of the sample. You can see that it's hardly distinguishable from the paraffin, which is outside of the kidney. Here we are using 30 micron spot size and 50 hertz repetition rate, so it's considered, you can consider this quite fast mapping, and the size of the map is over 100,000 pixels in meaning spectra. So you can see the distribution of calcium, magnesium, and sodium, and you can see that the distribution is changing with respect to position in the kidney. Also, there are some hotspots of calcium, sodium. We also can see some sodium, carbon, phosphorus, and other elements. It's just worth mentioning that those intensities in the maps are just rescaled from 0 to 1. Just we are providing still qualitative imaging, so some semi-quantitative changes. So far, there's also in other presentations in terms of imaging, we are not doing quantitative analysis. We are working on this, so hopefully in the future we are able to do some quantitative imaging. So right now we are discussing with biologists what we can imply from, or we can just derive as some information relevant to biologists from those images. And you can see that the polycystic, as I said before, you have really some holes in the kidney that we are just doing this. We harvest those organs from mice in just different week, just from the birds. So it's from the birth of the mouse it's infected by this polycystic kidney, and from in 10, 20 weeks, we are just harvesting those organs before the mouse dies, and we just try to do some relevant imaging. What I would like to also mention is that we are also, when we are just doing some elemental imaging, so in the end, you arrive to a point where you have images of different elemental lines or different elements. This is sort of so to say hyperspectral image, and as it is done also in geology and other applications, you can do some really simple clustering of those data. We tried and also already published something similar in the cancer research, where we just did some clustering of cancerous tissue with respect to some normal non-infected healthy tissue. So we are using self-organizing maps. I'm not going to speak about this optimization in the clustering, but we are doing some simple self-organizing map with just very simple algorithm of artificial neural network. And we are using k-means clustering. And in this case, we have 4 clusters. You can see that one cluster, the salmon pink color is just the paraffin around the kidney. And then you can see different regions within the kidney, depending on different intensities and correlations between different elemental lines. So this is just what we are working on. We are also working on this in the case of cancer tissues, where it is really interesting to see cancer and healthy tissue, just the division between those two, just some border. For the case study number 2, we are just I'm going to show some hard tissue results, and this will be just limited to some analysis of murine incisors, some front tooth, and some jaws, some just bones in. So what we can see here is just clearly seen the progress that we made in elemental imaging just in last year, that you can see that there is a really nice image of the incisor embedded in epoxy. Now we are just switched to hard tissues, so we are now embedding those tissues in epoxy, just cutting them and polishing them finely with some diamond pastes. And you can see the distribution just very simply, just the difference what we had before, 100 micron resolution, 20 hertz, and now we just moved to 16 micron resolution, the step size, lateral resolution between different between individual spots, and 60 hertz repetition rate. So you can see that we have just increased significantly the amount of data that we can provide by single analysis. You can also see that in the enamel, the intensity is quite higher. So we are also thinking about how to do and what to do with the signal standardization. This is another goal that is really important, because the metrics is changing, the hardness of the tooth, the hardness of the bone is just different, and then providing such data, it's really important to do some standardization. This is something that we are working on currently in our research. Okay, what we are just doing right now, also with cooperation with the Czech Academy of Sciences, is that we have this murine jaw with incisor, as you can see here, and we have those different mice that are just exposed to various toxic atmospheres. As I said, we are just now considering lead atmosphere. Just there is some concentration of lead particles, and there is some control sample which contains no lead in the end, as you can see, and also some 6 weeks and 9 weeks analysis. And you can see that with increasing time, of the exposition, there is also increasing content of lead within the tissue. You can also see the distribution of the lead within the tissue. Just again, calcium, magnesium, those are just some images of some major elements, and also we are providing also the analysis of strontium. As I said, there is we are just doing some sort of trick here, which is quite simple. First, we are doing the analysis with 30 micron spot size, which is quite, for which you get quite small plasma, small ablation crater, and this means also smaller sensitivity. But for calcium, magnesium, it's quite sufficient in terms of detection of lead and strontium and other elements. We are just changing the lateral resolution to 100 microns, just being a bit more rough on the ablation, just ablating more sample, and then you can see that we are also increasing the sensitivity like this. You can see also the sizes of those maps for individual samples and individual analytical approaches. So those are very briefly some results that we are able to provide and do the analysis. And just let me really briefly do some summarization of my work, just some recent results that we can really provide the analysis of soft and hard tissues. I'm just showing only the analysis of murine samples, but we are also working on the analysis of human skin cancers that we have also already published. And you can see that those protocols, the optimization of soft and hard tissues is different. So we always need to provide some optimization. We need to really just alter all possible parameters to be able to give the best possible analytical performance of the system in terms of lateral resolution and also in terms of sensitivity, which is quite crucial for some elements and some applications. So there are some iterative improvements what we have done so far, that we are just iteratively improving the lateral resolution, sensitivity, and then we are getting big data. So we have to also do and consider data processing. For data processing, I would like to also mention the importance of quantitative analysis. It's just the goal for future research, and also do some signal standardization to really mitigate the influence of metrics effect within the analysis. And finally, the potential here, as you have already seen also from our other publications, you can see that the analysis of human cancers and some sort of implementation of LIBS to clinical research might be something, a motivation for next an ongoing research. And also doing some clustering of characteristic spectra that we have already shown and published, and it might be really interesting for different applications, as it is done in geology. In other applications, this might be done in biology, but this is more complex and challenging data processing. Finally, let me also acknowledge the contribution of my co-authors, especially Anna Konečná and Hanna Kopřivová from CEITEC, Lucie Vrlíková and Marcela Buchtová from Czech Academy of Sciences, and other colleagues that really contributed a lot to our research so far. So I would like to acknowledge some grant support, and I thank you for your attention. I'm just really happy to answer some of your questions.
Oh, thank you very much for the interesting talk. So now this presentation is open for questions, comments. So as far as I know, there is no question from the web. So in the case, on site, so are there any questions?
Only one question.
Okay.
First, congratulations for this wonderful work. Yes, so you mentioned that this technique can be potentially used for cancer diagnostic. This is a very important issue. However, I think the major difficulty is that you need to cut the tissue and prepare it, then make the mapping. So all of this need, in fact, to quite heavy intervention on the patient. So what is your comment, for example, with respect to compare to a no-invasive technique, like, for example, blood analysis? Can you compare such mapping technique, which is heavily invasive, and light invasive technique like blood analysis?
Yeah, this is really good question, and surely there are other techniques that might be used directly in vivo during operation. I think in the United States they are using Raman spectroscopy directly for this kind of analysis. What we are trying to do is to just do this because when the biopsy is being done by surgeon during the operation, so they always need to do some histology analysis, and we are now trying to complement the histology analysis with elemental imaging. As you can see here, you can just provide the analysis on just the elemental map, and what we are trying to do is to help to provide some another information that will help the histologist, the pathologist, or the surgeon to estimate the boundary between the healthy and cancerous tissue. So this is where we are going with this. Yeah, so we are just complementing the histological analysis that is always being done when the biopsy is taken from the patient. Yeah, so this is where we are just putting our research at this moment.
So, hello, Pavel. Hello?
Hello.
Yeah, can you see me?
Nice to see you.
Yeah, I just want to, I have several questions for you, but there is no time to ask. Maybe we can discuss by email after the
Yes.
meeting. So here, I just want to say hello to you.
Okay, thank you.
Thank you very much.
Sorry, Pavel. So if the time is quite 2 hours, so now I'll give time
Yes.
to the Professor Douglas for next talk. Yeah.
Sorry.
Okay.
Thank you very much.
Thank you very much, everyone. Have a nice day and enjoy the rest of the